briefly about our organization. We've been around for about a little over 20 years, and we work very closely with some of the state agencies like Department of Human Services and many health systems and social service providers in our region. We're kind of like a think tank, I guess you could say, really looking at public benefits and human services policy and programming. We do some community planning and data analysis around different issues. We also have a language access resource center in which we train bilingual individuals to become interpreters. And then we do provide interpreting and written translation services to a number of different entities, healthcare providers, education settings, and more. My primary role there, as Sue mentioned, is I'm the Director of Training and Technical Assistance. I will say I'm usually training the social service and healthcare providers. And so it's really a treat for me to speak to all of you today and try to give you some baseline information about the various Social Security programs. I've been with the Federation about 8 years, and honestly, the policies and programs are so complex that there are some days that I feel like I'm brand new trying to find an answer to a question. I've worked closely with the social workers at the Northwestern Cancer Center, and so they always ask me great questions and usually stump me because usually by the time they come and ask me a question, they've gone their usual route. They're very knowledgeable, and so it's always fun to connect with them because complex situations arise, and it's a learning opportunity for me, and that's why it's good. So, but today we are going to talk about the Social Security programs. And I thought I would just start with a quick review of terms, because when we talk about government benefits, I call it the alphabet soup of acronyms. You will see these various acronyms throughout today's presentation. You will have access to a PDF copy of this presentation as well. So don't feel like you have to write down a bunch of notes or anything like that. I've told Sue she can send it out to everyone who participated today. But these are just some terms, and I will do my best to define those throughout the presentation today. I'm not going to go through each one right now, but just so you have it for future reference. So when we talk about the cash benefit programs that are administered by Social Security, there's really two types. The one bucket comes from Title II of the Social Security Act, and that's the Retirement, Survivors, and Disability Insurance. And I really want you to think of those programs as insurance programs, because to access those programs, someone must have earned enough work credits to a point that they're considered insured. And so when people reach retirement age, they may start drawing their Social Security, right? But if someone becomes disabled under these Title II benefits, it's SSDI, or Social Security Disability Insurance. And then there's also, under this umbrella of Title II benefits, the survivors benefits for when a wage earner has passed away. And I'm going to talk a little bit about each of these programs, because I do think sometimes families have options for one or the other. And so we'll just kind of do some level setting and talk about each of those. In addition, Social Security administers another cash benefit program that's completely separate from those Social Security insurance programs, and that's known as SSI, or Supplemental Security Income. And this is really meant for our low income individuals. Maybe it's people who do not have a sufficient work history. They've never, accrued those work credits through earnings. They're very low income. They don't really have any assets, and they're either aged, blind, or disabled. And so I will just start the presentation by saying people confuse SSI with SSDI all of the time. I used to confuse them myself when I used to work in a different program where I was a case manager. Clients or patients often confuse them too. And so if anything, by the end of today, hopefully you'll know the difference between SSI and SSDI. But let's talk about those insurance benefits first, right? Those Title II benefits, whether it's retirement, survivors, or disability insurance. So what what is it that someone needs to qualify for these insurance programs? Well, at a minimum, you have to have the sufficient work history, and I'll talk about that probably on the next slide. You are either a US citizen or a qualified immigrant, and there's some strict rules around what that definition is in terms of a qualified immigrant. So they had to have been here lawfully, had to have had a work permit to be able to legally work in the United States. But if they have been contributing to the system, yes, indeed, qualified immigrants can access this because it's an earned benefit. For retirement, you have to meet the age criteria to start drawing retirement insurance. For survivors, this is when the wage earner has passed away and either a surviving spouse or dependent child can receive based on certain criteria. And I will share those criteria with you. And then for disability insurance, or SSDI, not only does the person have a medical condition that is disabling, but that it is preventing them from doing any work. And so I will also spend some time talking about that. So first, what is sufficient work history? Essentially, someone has to have drawn income and paid into the FICA tax system, and that can either be through a job where they're earning income or through self-employment and paying the self-employment taxes to be paying into the system. And generally, you need 40 work credits to be able to draw your retirement, survivors, or disability insurance. That works out to be about 10 years of work history because we can earn a maximum of 4 work credits per year, and it's based on how much money we earn. And right now in 2021, if we earn up to $5,880 within the calendar year, we've met our 4 work credits. They used to call it quarters, and you'll sometimes still see it referred to as qualifying quarters. We don't need to get into all the details around that, but just know, generally speaking, someone needs about 10 years of work history. With disability, I'll share a little bit later some nuances with that, but in general, we're looking at about 10 years of work history. Now, whose wage credits or whose work history counts? Well, certainly your own. You know, if you have that sufficient work history, then Social Security will look at your earnings record. But it could also be a spouse or even former spouses if married for at least 10 years and meeting some other criteria. Social Security will use your spouse's work history if you have insufficient wage history on your own. And then parents of disabled adult children, disabled adult children can actually qualify under their parents' record as long as the disability started before age 22. That's really a special, some special policies around that population, but if you have questions, we can certainly try to answer those. So let me just talk briefly about retirement. When can you draw retirement? Because sometimes this is a decision point when people are also considering applying for disability insurance around the age 62. So everyone can retire early at age 62 as long as they have those sufficient work history. But for financial planning, it's important to understand that that is a reduced benefit. And it's a lifetime reduction. It's not like you get to draw this reduced benefit and then once you reach your full retirement age, oh, that benefit will increase. No, if you decide to draw early retirement, it is a reduced benefit going forward. So people need to know when their full retirement age is, because when you reach full retirement, that is when you can draw your full benefit amount of what you have earned over the years, so to speak. Currently, it's indexed to age, and right now, anyone born in 1960 or after, the full retirement age is 67. If you were born before that, let's say 1956, then your full retirement age is most likely 66 in some months. I sometimes share too much information, but my mother was born in January of 56, and so her full retirement age is actually next April. And let me tell you, she is counting the months, but anyway. So if you're born before 1960, you may want to go to the Social Security website just to see what your full retirement age is. So the question we sometimes hear is, well, if someone's disabled and they're age 62, should they just go ahead and draw their early retirement? And often we get this question because people have heard how long it can take for Social Security to process a disability application, and oh, wouldn't it just be easier to draw retirement? And so really what we would say is to be cautious. If truly the person would meet the medical criteria for disability, it's better to go through that disability application process, because then they will get their full benefit rate. And then once they turn full retirement age, whether that's 67 or 66 and 4 months, then their benefit would convert to the full retirement benefit. So just something to think about. And this is an example that shows this in action. So we've got Jimmy. Jimmy is 62, recently diagnosed with esophageal cancer. He's told that if he gets to full retirement age at age 66, he will receive $2,056 a month. That would be his full benefit rate based on his work history. He's 62. He certainly could draw his early retirement, but it will be reduced, and it's reduced to about $1,500 a month in his case. But if he's approved for SSDI, he would get that full benefit rate. So depending, this is just a consideration people should think about when deciding to file a claim with Social Security. And I'll talk a little bit more in a moment about what Social Security is looking for in terms of medical evidence and how that disability determination is made. So that's retirement. I did also want to mention survivors' benefits so that families are prepared and know what someone could receive. And again, this is maybe when the spouse has passed away or the parent has passed away who was a wage earner with a work history. Those surviving spouses or children can receive a benefit through the survivors' benefits insurance program if they meet the criteria listed here. So the surviving spouse needs to either be a caregiver of a dependent child age 16 or younger, and that child is also qualifying for benefits through this, or the spouse is age 60 or older, or if the spouse themselves is age 50 and disabled, and they don't have their own work history to draw Social Security disability benefits, they may be able to get survivors benefits if their spouse had passed away. And then also age 62 or older and not able, again, to qualify on their own wages. And then on the right, you see the children criteria. So essentially, children up to age 18, or if they're still in high school through age 19, or disabled adult children, as long as that disability started before age 22 for the child. So here's an example. We have Teresa, 52 years old. She's only worked 2 years on her own paying into the Social Security system. If she is now diagnosed with ovarian cancer and she's no longer able to work, she can go to Social Security, but she doesn't have a work history on her own. Now, certainly SSI may be an option for her, but when filing a claim through Social Security, she wants to report all information, including her spouse, her former spouse, or her deceased spouse. And Social Security is supposed to do that check and see that she is eligible for survivors' benefits based on her disability and her age and her relationship to her spouse. So that's why we say when filing a claim to be as thorough as possible with Social Security, even former spouses. If there was a former marriage and it lasted at least 10 years, and then there's some other criteria, list former spouses, because Social Security is supposed to really make sure to maximize the benefit that someone is eligible for. And they'll look at not only that applicant's work history, but the other persons as well, the spouses. But today I really wanted to focus in on those benefits for persons with disabilities. And as I mentioned at the outset, people confuse SSDI and SSI. all the time. And so I put together this chart, side-by-side comparison. So again, SSDI, it's based on your work history. So there's no limits necessarily in terms of assets or resources, things like that. The health coverage that will come along with SSDI is Medicare, but that doesn't come along until after someone has received SSDI for 2 years or 24 months. And then SSI, again, really meant for our low income, low resource, vulnerable populations. So someone maybe didn't have a work history, doesn't have a pathway to benefits through a spouse. If they meet the income limits, or not even, income limits, but the resource limits, all of that, they're citizen or qualified non-citizen, they can maybe access SSI if they meet the medical criteria and such. And then it's low income, so Medicaid eligibility is usually available to individuals with SSI. But Medicaid and Medicare are really a topic for another day. Both can be complex as well. That's something I do a lot of training on with providers. So there's these two options, right, for disability benefits through Social Security. And I'll talk in a moment about how, there are some non-medical criteria that must be met for either program. But when we think about the definition of a disability, I wanted to share Social Security's very strict definition. It's not just that someone has a physical or mental health impairment. It's that impairment is preventing them from doing any work. And what they have done here, and that's what substantial gainful activity is really work, our ability to work. So you can see their definition refers to that. It can be a physical or mental health impairment. It could be multiple conditions. And then they do have a prognosis. So the condition is either expected to result in death or will last for a continuous period of at least 12 months or longer. And so I sometimes use the example of pregnant women who end up on bed rest and unable to work because of pregnancy complications. They will never be able to access these benefits because a pregnancy has a fixed duration, right? So, and it's same thing with injuries maybe sustained. I had a coworker whose daughter was in a severe motorcycle accident and was really unable to work for about 6 to 8 months. But again, her prognosis was that recovery would happen within that 12-month period. So she was not able to get disability, even though she was really bedridden for a while and really needed a lot of support. So this is their definition of disability. And then when we apply for disability benefits, we have to show medical evidence meeting that. But before I get into that, let me just revisit this work credit conversation again. So for SSDI, Social Security Disability Insurance, the number of work credits, they will take into consideration the person's age. And so they really do account for a younger person who maybe hasn't had that chance to accrue 10 years of work history yet. So if it's a 20-year-old, they do allow a lesser number of work credits. But in general, they need 20 to 40 work credits depending on age. And then if approved for SSDI, you will get the full benefit rate, even if someone's younger than the full retirement age. That's kind of what this slide is trying to say here. I realize this one happens to be a little wordy, but our example is D'Angelo, who's 50 years of age. He's become disabled. He could get $2,000 a month at his full retirement age of 67, but if he applies today and is approved, he'll get that full benefit rate. So, and then what happens when they turn full retirement age is that Social Security will convert it to retirement benefits. And the person themselves really won't see any change in the amount. It's kind of a behind the scenes from what pot of money the benefit is being paid from. Each year, I will say someone who's been on Social Security benefits, they usually see a slight increase in benefits each year. That's due to just cost of living adjustments. I think many of us would say it's usually not enough given inflation and other things, but anyway, it does slightly go up each year. And then just a Quick thing about SSI in terms of the non-medical criteria. Again, I mentioned this is really for low income, low resource. And what we mean by resources or assets is that their resources for a single person are limited to $2,000. So that's things like money in the bank and such. For a qualifying couple, it would be limited to $3,000. And then currently in 2021, the maximum that someone will receive in SSI is $794 a month for that single person, or for that qualifying couple, just under $1,200 a month. Again, SSDI, the amount varies. So not everyone receives the same amount with SSDI because it's based on your work earnings history. But with SSI, this is what the maximum allotment would be. And then in terms of what does Social Security look at, what do they count for resources or assets? They don't count one vehicle. They don't count the home that someone lives in, you know, your other kind of household property and such, appliances and whatnot. There's some limits in terms of prepaid burial plots or life insurance, kind of what's the cash value if you were to cash those out. But they do count, you know, really any other income, any other money in the bank or investments, other property. So if someone maybe rents out another property, that would count. And so some people are not able to access SSI because they're over the resource limit. So I just wanted to kind of start with the non-medical criteria before we start moving into some of the process with filing a claim. Now you can start everything online with Social Security. In fact, for retirement, survivors, and disability insurance, you can do everything online and file the claim. With SSI, some people can do everything online, but many people need to make an appointment for applications. And so I've given you the 800 number there as well. The SSI is a much longer application because it really does get into all that financial history and just a lot more really identifying resources and things like that. Sometimes people think, oh, well, if I transfer my resources to someone else, you know, maybe then I'll meet these criteria for SSI. And I just have to say to be very cautious about that because there is a look back period. Similar to if someone needs long-term care, nursing home care, they will look at that. And so there are some ways that you can transfer certain assets, but you really need to work with someone like a special needs financial advisor or someone who's familiar, a disability financial advisor to do that properly. That's even beyond my scope of knowledge. Frankly, I would need to call on someone to help if my family was in that situation. But you can start at sasa.gov, and I will say, you know, I get on a lot of different government websites. I find the Social Security Administration's website to be incredibly user-friendly. I can usually find what I'm looking for. They have so many different publications and materials available online. I find it to be overall pretty user-friendly in readability, like easy to read. So I do encourage you to take the time and explore this website if you've not done so already. And you can see this is just a screenshot that I took the other day. You can see even just the button is right there to apply for disability, but lots of different things to help people plan. And same with retirement or survivors benefits as well. So let's take a little bit of time to talk about the actual process of how Social Security looks at a case and determines whether or not they're disabled. And so this is what we refer to as the disability determination process. And overall, when someone submits a claim to Social Security, that's where we start, right? We start at Social Security. And then what they do is they're reviewing all that non-medical eligibility, whether or not someone's still working and how much they're earning per month. Because if you're working over a certain amount, maybe you're not considered disabled. So that is one of the non-medical things they look at. They look at citizenship status, relationship, marriages, children, all of that. With SSI, they're going to look at that financial information. Once they've determined that the applicant or the claimant meets all of the non-medical eligibility, what they do then is they transfer the claim to the Bureau of Disability Determination Services. And so this is actually a state of Illinois agency. It's under the umbrella of the Illinois Department of Human Services, and we call it DDS for short. But it's there that the claim is assigned to a disability examiner. This is usually a nurse or someone with a medical background who will review the record. And this is the entity that is looking and reviewing medical evidence to see if it meets the criteria of a disabling condition. This disability examiner will never meet the claimant, right? And so this is our opportunity to really make sure that when we apply for disability or we file a claim, that we are, if possible, including as much medical evidence right away. If we don't, Social Security, DDS, it's their job to contact all of the different treating providers and request that medical record or those medical records and other information back. And that is where the process can slow down. If you file your claim and then we're waiting on Social Security or DDS to contact all of your providers, and then how timely is the provider in turning around that information, this is where we can see big legs in the time it takes to get the claims processed. So whenever possible, especially with current medical records, trying to submit that at the time of filing the claim is one way we can help speed up the process. I will admit, though, there's a challenge because nowadays there's many times medical providers are contracting out their records departments to like a third-party vendor. And so sometimes they want money, right, to copy those medical records. And you can request waivers, but it can be very challenging. Usually when SSA or DDS requests it, there's some different systems set up, but whenever possible, I find it incredibly helpful to include the medical records at time of application. And so then again, that disability examiner is the one who's going to review the medical records, determine yes or no, the person meets the definition of disability. If approved, well, either way, approved or not, they return the record back to Social Security, who then communicates to the claimant that decision, whether approved or denied. And there's a 5-step process to disability determination. So I'll just walk briefly through this, and then I really want to focus in on step 3. So when a claim is sent to SSA and then on to DDS, first of all, SSA is going to look at step 1, is the person working at substantial gainful activity? So are they working? Are they earning an income? SGA is Social Security's term that describes a level of work activity and earnings, and it's considered substantial if you're doing significant physical or mental activities to do the work, or a combination of both, I guess. And then it's gainful if it's for pay, or expected, to be performed for pay or for profit, or, if you're not being paid, it's generally of that same level of work. So, sometimes it might be self-employed and you're intending to realize a profit, but that doesn't always happen, right? So this is what they're looking at. So sometimes they look at hours of work in a month. In 2021, right now it's set at $1,310 a month. So that means if someone is working and earning $1,500 a month, Social Security may look at that application and deny it right away without even looking at the disabling condition, because it's considered to be over the SGA amount. Now, there are ways, especially once benefits are in place, where people can return to work and even keep their benefits. There's some different provisions such as trial work period and some other protections, but people really need to work with Social Security to do that and return to work and report work. If you don't do that, you could risk being in an overpayment situation later. So this is a bit of a sidebar from this slide, but I think it's important to note that people indeed can receive both, but have to work with Social Security to coordinate. But let's just go with the standard of, okay, they're looking at SGA. And so as long as someone is below SGA of 1310 a month, then they will move past step one. Then they're going to look at whether or not it's a severe impairment. Basically, is there a way to determine this medically? And does that severe impairment prevent work? That's what they mean by severe. If yes, then we're going to go on to step three, which is, does the impairment meet or equal the listing? And I'm going to talk about listings shortly, but this is the listings of impairment, and it's all the medical criteria that someone must meet to be considered disabled. Step three is really key, and I'll tell you more about that, because if they are meeting the listing, the process stops there and they're approved. If they don't meet the listing, so they don't meet the medical criteria, then Social Security has the right to go ahead on to step 4 and 5. One is, does the impairment allow for past relevant work in number 4 there? What that means is, okay, I didn't meet the listing of impairment, but maybe I am unable to do my current job. Maybe I was trained as an accountant, but then I decided I wanted to be a farm worker, or maybe I wanted to be a construction worker. And then I get injured on the job and I'm no longer able to do that work. Well, Social Security may say, well, your condition, yeah, prevents you from lifting things, but to be an accountant, you don't need that. You can go ahead and go back to your accountant work. So I hope I'm explaining this in a way that makes sense, but they have the right to look at your past work experience and training to see if you can do any other work. And if yes, they determine you could go back and be that accountant, then your application would be denied at step 4. If they determine, no, you can't really go back to do that work either, then they have the right to still go on to step 5, and they have this whole dictionary of occupational titles, and they will look and see if the impairment allows for any other work. It doesn't matter if that work exists in your geographic region, but can you do any other type of work? And from a trivia standpoint, it's a really interesting document to access. I think you can find it on their website, everything from tennis ball tester to farm work and other things. So this is the overall process, but let's focus in on step 3, because this is where especially people with a current medical condition have the opportunity to access those medical records to really make the case. So the listings of impairment, I've included a screenshot here of the adult listings. There are also child listings. Children, just as a side note, can access SSI for disabling conditions as a child under age 18, but with children, their parents' income does count. So just FYI, that's if the child has the disability. So sometimes we see children denied because the parent's income is to a point where it prevents the child from getting SSI. But for most part, what we want to focus in on are these adult listings of impairment. And you can see they break it down by body system. So they have a whole section here, chapter 13 or section 13, that is on cancer. And so you can click on that and actually see by different diagnoses exact medical criteria that they're looking for. And then what people can do is when they're filing their claim, make sure that they have the medical records that support the criteria listed here. But if people have more than one diagnosis, it's recommended that everything is listed. And so perhaps, yes, someone has a cancer diagnosis, but maybe they have some other issues as well. Maybe they have a respiratory disorder, or maybe they have a mental health disorder. Everything should be reported because they will give weight to the fact that someone has multiple conditions. And just so you know, if you are looking this up on the internet and doing an internet search, even if you type in SSA Blue Book, it'll take you to it. It's not the Otto Kelly Blue Book, but the Social Security's listings of impairment is also known as the Blue Book. So I said step 3 is really key, because if the person is found disabled here, then the application process stops and they can be approved right then and there. And really what they're looking for, it's not just the diagnosis, but also there's a component to someone's ability to function and carry out daily activities, to be able to work. But that medical criteria is important as well. And so what is medical evidence? What could we include with a claim? So certainly medical records, and really from all treatment sources, especially recent treatment that is pertinent to the disabling condition. Medical providers, clinical psychologists, social workers can also provide statements. Any medication that someone takes should be included. And then even collateral sources, sometimes family, friends, social workers, others, they can type up a letter explaining how the condition prevents the person from working. So it's just not always straight up medical records, but it can be all of this other kind of collateral information, because that tells more of the story. That puts all of the pieces together for that disability examiner who's in Springfield just reviewing records. If approved, what will happen is Social Security will communicate that, and then benefits have to be either direct deposited into a bank account, and if someone does not have a bank account, then they will receive a debit card, a direct express debit card. So it's been a long time. Those days of checks being received in the mailbox are long gone. Excuse me. And then when can benefits begin? This is often a question that people have, and really it depends on what program the person is receiving. So retirement and survivors usually starts within a few months of filing the claim. SSI begins the month after application or protective filing date, whichever one is earlier. And I'm going to give you an example to explain this. Because what we all know is that, well, you might apply today, but SSI or Social Security isn't going to approve it right away, right? It does take time. So I'll give you an example. And then SSDI, technically, people can start receiving that benefit 5 months after the date of onset, or no earlier than 12 months prior to the application if the onset was earlier. So we know that sometimes people wait a long time to apply for disability for many different reasons, but the earliest they will go back is 1 year prior to the date of application, even if the disabling condition technically started 2 or 3 years ago. But the reality is we know that Social Security, it does take time. There's no doubt about it that there is sometimes a backlog to processing these applications. And so let's take a look at an example or 2 examples to kind of showcase each of these, SSI and SSDI. And let me just define real quickly, date of onset. This is the date that Social Security determines that the disabling condition has begun. So that's not something, we may have a good idea of that, but it's really something that Social Security or DDS determines based on the medical evidence. So 2 examples. First, let's talk about Lester. So Lester sets his protective filing date on February 26th because this is the date that he filed his appointment or requested an appointment for an SSI application. And let's say in this case, they were actually able to process everything really quickly. They did maybe a phone interview with Lester in March, and Lester just had everything ready, and they were able to determine that he was disabled, and they approved him for benefits in May. So remember, with SSI, that can begin 1 month after application or protective filing date, which for Lester was February 26th. So his benefits will actually start as of March because it's the month following the protective filing date. Now, if he had waited until March 1st to set his protective filing date, his benefits wouldn't start until April. So really interesting in terms of timing towards the end of the month when someone is filing a claim. But he's not notified until May. And in reality, Lester may not hear until September, right? We hear sometimes where some claims take a very long time for decisions to come back. Even if it's not until September or October that Lester's notified, because it's an SSI application and he's approved, it starts in with back pay from March forward. Then we have Kima. Kima also applies on February 26th. She is applying for SSDI, however. And let's say due to a compassionate allowance, which I'm going to talk about shortly, they process her application very quickly, and she is determined disabled, and she's approved in May as well. SSA looks and determines by medical records that the date of onset of her condition actually goes back to June of last year. But benefits are issued from 5 months after the date of onset, right? So if her date of onset was actually last June, if we go forward 5 months, if my math was correct, her benefits will be issued from November of 2020 forward. So this is a really confusing process sometimes. We could come up with all sorts of examples, but this is why sometimes you'll see people get a large lump sum right away. And it's because it depends how long it takes for Social Security to process the application, and then also, the back pay then and the timing of all of that. But I hope that helps explain a little bit. Now, what if someone needs benefits sooner? Can we expedite that request? And it depends, right? It depends on those with serious medical conditions. And there are 3 ways that Social Security can kind of move the process along faster. So expedited payment is something with SSI applications. Again, this is where Social Security can see clearly that the person is going to meet disability standards. Quick disability determinations is actually, it's a computer-based predictive model. So the system itself screens the initial applications, and then they go ahead and are able to approve it quickly or kind of speed up the processing. And then compassionate allowance as well is another way to really identify conditions that need quick handling. And to be honest, many of these are often certain cancers, but it's other conditions as well. Let's actually take a look at those. This is just a sample, and it's just the part of the A listing so far. But you could actually see from the Social Security websites all of the conditions A to Z that they consider compassionate allowance. And essentially, it's just a way for them to handle the case quickly and make the decision faster so that the application process doesn't drag out for a year or more. We are almost done. So let me just wrap up quickly with a few additional pieces of information that are kind of nice to know. For someone who is receiving Social Security retirement or disability benefits, similar to the criteria for survivors benefits, when the wage earner, though, is drawing their own benefit, the spouse and dependents can receive a portion of benefit too. So this is not available with SSI, it's just with either SSDI or retirement. So let's say the head of household maybe becomes disabled, is unable to work, starts receiving SSDI, they have a spouse and or children at home, that spouse and children can receive an additional benefit as well. It's not the full benefit rate that the disabled individual is receiving. It's usually up to 150 or 180% of that. And the criteria, very similar to the criteria for survivors benefits. So I'm not going to run through all of that again right now. But just as an example, we've got Jimmy and Beatty. Jimmy starts collecting SSDI. His spouse doesn't have her own wage history, and the spouse is already 62. Because of that age criteria that Beatty meets, she can actually receive a benefit off of Jimmy's SSDI benefit. I once worked with a family helping them apply for health coverage, and that was the family's sole income. Dad was on SSDI, mom was caregiver of children under 16, and there were 2 children. And so dad had a benefit as well as the spouse and the 2 children. And this is just an aside as well. You know, sometimes people wonder, well, how long can I receive it before something changes? And really, this law requires that the Social Security needs to review medical eligibility at least every 3 years, if not sooner. And if someone returns back to work, that will trigger a disability review. But sometimes that doesn't happen, especially if they are working with Social Security in the Ticket to Work program and kind of trying out the return to work. So this is just kind of extra information for you. If you don't have a My Social Security account already online, I encourage you to set it up. This is where you can see, you know, if you were to file for retirement or disability today, what would your benefit be? It's a good opportunity for you to review your earnings history. They used to send us this letter every year, but they stopped doing that. You can access it here. If someone is already drawing benefits, they can pull up that benefits verification letter and see what it is. If Medicare is being taken out, it'll be there. You can do a lot through My Social Security, changing addresses, reporting work hours, and such. And these are just some links, I've referenced a few of those throughout today's presentation, so I wanted to make sure to give those to you at the end. And with that, I know that's a lot of information in 50 minutes, but I hope at least that it gave you an overview of kind of the process. And just know each case is a little different, so we just need to acknowledge that as well. This is our website. I will say I primarily work with providers. We do not provide direct assistance to families or consumers. It's just not something that we have the wheelhouse to do. I will say that is one challenge. There isn't a lot of support out there in terms of organizations who help with initial claims. Yes, there are disability lawyers out there. There are disability financial planners out there. But really anyone can file the initial claim. And when we run into issues or need to appeal, sometimes that's when people will go for legal assistance. And depending if someone is of lower or moderate income, there may be some free resources. Prairie State Legal Services sometimes will help at the appeal stage for disability claims. So that's just something to think about as well.